Hello everybody. Let's do the HQ challenge number 23, just kind of warming up for the spring semester so when you head back to school, it's not such a rough transition. Okay, which of the following is the suspected diagnosis and the appropriate diagnostic tool? So we're coming up with diagnosis as well as how to, or the disease process, if you will, as well as how to diagnose it for a patient that presents with sudden shortness of breath, Virchow's Triad, and a D-dimer of 560. All right, so let's just pick this apart to figure out what we think it might be. So sudden shortness of breath, that could be a whole plethora of things, okay? So it doesn't tell us much except the patient's in distress. But when we talk about Virchow's triangle, that tells us a little bit more, okay? So Virchow was a German doctor, and he showed the link, or identified the link between blood clots and three things, okay? Those three things really quickly is hemostasis, which means the blood's not moving a lot, okay? So this is why early mobilization is so important, so we don't have hemostasis. That's one of the reasons. The second part of this triad is vessel trauma of some type, or epithelial damage of the vessel lumen. It's kind of complicated, but just to summarize it, this is what keeps the blood in our blood vessels when we have an injury, so we're not spilling blood out into the interstitial compartments, okay? And then the third part of this triad is hypercoagulability, which is just the tendency for the body to form more clots, and that's typically because there's some kind of underlying disease process that causes that to happen. Okay, so just knowing that a patient presents with this Virchow triad leads us to believe that they may have a blood clot, like a DVT, which if it breaks loose can cause a pulmonary embolism, which might tell us why he's short of breath. And then a D-dimer, this is a test that tests for the breakdown of a fibrin protein. Okay, so anytime the body forms a clot, it starts immediately breaking it down. So when you have higher D-dimer levels, that means there's higher probability of clots that are already trying to be broken down, okay? So a D-dimer of greater than 500 is a screening method for a pulmonary embolism, okay? So all of this tells me that we potentially have a pulmonary embolism, so that narrows us down to D and E. And then we have to figure out how to diagnose it. And of these two, CT, so a CT scan, right? CT pulmonary angiography, that gives us a look at that blood vessel to know if it's obstructed or not, okay? VQ scans may be screening tools, but they are not diagnostic, okay, because there's a lot of error in a VQ scan. It's really only accurate in very extreme states. So we do not diagnose a PE with a VQ scan. We diagnose a PE with a CT-PA, which is how you'll see it on the MBRC exams. Okay? Hope this helps. See you soon.